Hi, Rick. I'm here with Rik Mashura from Central Park Physical Therapy, and I'm getting great help with him, so I just wanted to talk to him about the great services that Central Park Physical Therapy offers. How are you today?
I'm doing great, Corinne. Thanks for coming by.
Thank you for having me here. So can you tell me how you started out getting into this industry?
Sure. I started over 30 years ago, and I actually started with an injury to myself playing sport. And I injured my knee, went to an orthopedic surgeon who told me I required surgery. And at that time, I couldn't afford the surgery, didn't have insurance.
Oh.
And the doctor said, okay, well then why don't you just try exercising and see how that works out. And that's what I did. I pretty much taught myself exercise, and my knee eventually did get better within a year. And I was what we call fully recovered. And then the other thing that was very helpful in me becoming a physical therapist was the fact that at that time I had a girlfriend who had neck pain from a car accident, and I enjoyed working on her muscles and massaging her neck and her back to help her recover. So those two things together, the hands-on and the exercise component of physical therapy, is what I learn how to do it well, and I do a lot of that right now. In particular, I do it with a lot of dancers and entertainers, being that I'm here on Broadway.
That's fantastic. So do a lot of dancers have a lot of problems with their joints from...
A lot? No, probably all of them.
All of them?
All of them. Basically
Really?
all of them, yeah. Basically they're going to have problems because they're beyond athletes. They're, typically an athlete will work, rest, and dancers have this compulsion to dance, work every single day, constantly, without giving themselves rest, and so they usually have these overuse type of injuries, and so they get the injuries, and they'll come in here and we'll help them to resolve it, and also do some training with them to help prevent that
That's
from
great.
reoccurring.
What kind of injuries do you see, in your experience?
Well, almost any musculoskeletal injury will come in here, besides the dancers who get their foot, knee, hip injuries, and back injuries. We do get our athletes that come in here. We have our workers. We're right here. There's a lot of business in the area, so we get our bankers, we get our executives, as well as the people who work for the executives, the secretaries, the janitors. So
Right.
a lot of work-related injuries as well. Sitting, working at a workstation, neck pain, eye strain, headaches, back pain. It's funny how you just sat up straight when I said that.
Well, that's good. I mean, I'm finding a significant difference from coming here and with my ankle injury, and I'm feeling a lot better from it. So I think people who have injuries or who have pain in any, from an accident or from just daily routine, could really get help, at your
Right. One of the things that we understand here, besides me, we have 8 other physical therapists, but we're very caring and confident in our work. We're caring, particularly, a lot of us have been athletes. I played up in my collegiate levels, and I got a couple of other athletes that were here that played in college as well. 2 of them were national champions. So they understand sport, they understand dance, they understand injury, and they understand how to recover. I've had so many injuries, I tell people I've been to the school of hard knocks.
Really? What else did you do to yourself?
What I did, I've had, the worst injury, I had a major ski accident where I was paralyzed for a while.
Really?
And for me to come out of that, it took about a year. It took about a year of therapy for me to recover. And so I know how to deal with that, that type of thing. I've had herniated discs, fractured bones, strains, rollerblading.
Really?
I've been hit by cabs several times. So,
several times?
Yeah, 3 times.
3 times?
So I'm done with rollerblading on New York City streets for now, but I'm not telling anybody else to do that.
Oh my God.
I just stay in the park now.
But you were paralyzed and you got out of it from physical therapy?
Right.
That's fantastic.
I use Feldenkrais also. We do different types of disciplines here besides physical therapy, so we get involved with Feldenkrais.
What is that,
Feldenkrais? It's an awareness, developing an awareness of your body in terms of particularly habitual patterns that a person will go into, and learning how to change those compulsions for the better. so we don't keep repeating the things that damage us. A lot of times people do these things unconsciously or subconsciously, and we do it with hands-on methods or with movement patterns.
Oh, that's fantastic. So how do people, sign up for that as well as physical therapy? What is the phone number of?
Oh, they just have to call 212-765-4800.
Great.
So we have an 800 number.
Okay, what's your 800 number?
212-765-4800.
Okay.
Our 800 happens to come at the end.
Okay, great. And I think your place really does work, and I appreciate you helping me with my ankle injury. And I tell Corine's Corner readers, if they have any kind of injury, or if they want to just be better, they should come here.
Right. I appreciate you making that recommendation. We're right here in the middle of New York on Broadway and 55th.
Great.
And just give us a call and we'll be able to help you. We've helped many people who haven't been helped in other locations. They were not as successful achieving their goals somewhere else. And here, they come in here and they do great.
Great. Well, thank you very much.
Thank you.
Okay.